Hello, everyone. This is Dr. Sanket Pisat. I am a consultant gynecological endoscopic surgeon practicing in Mumbai, India. And today we are going to be talking about the non surgical management of endometriosis. In one of our earlier videos, we have talked about what exactly is endometriosis and how it affects the different organ systems of the body and what kind of surgery is required in order to tackle this disease. In this video, we are going to be looking at the non surgical management of endometriosis. So, first of all, whether or not you require surgery for endometriosis and whether or not your condition can be managed by medicines alone is a multi pronged concept which cannot be decided upon by a few factors alone. Your treating gynecologist will take into consideration a lot of things before deciding upon whether you require surgery or whether medicines are going to be good for you. So, if your choice is medicines, or if you wish to not undergo surgery at all for any particular reason, what are the various options that are there in order to treat the endometriosis that you have? So, let's look at these one by one. The first option, which is probably the most commonly used, is simple oral contraceptive pills. Endometriosis is a condition of estrogen excess, and a lot of times it is associated with severe pain during menses. And these painful periods can sometimes be tackled by various different hormonal preparations, one of which is the simple oral contraceptive pill. Long term use of oral contraceptive pills, sometimes without a break at all, has been shown to benefit a lot of patients of endometriosis and relieve their symptoms in quite a few cases. However, one should know that there is a time limit up till which the oral contraceptive pills can be used, and they are good for use if this is a stopgap arrangement for some time, beyond which you are looking at surgery later on, or maybe you are not planning a pregnancy right now but planning a pregnancy in the near future, and then this method of treatment would probably be good for you. The other medicine that is used is a hormone which is called dynogest. And this dynogest is a progesterone analog. This dynogest makes sure that the level of estrogen in your body is reduced. Now, essentially, estrogen is the hormone that causes you to get periods, and estrogen is the same hormone that causes you to get more and more endometriosis as the time passes. Dynogest is a medicine that causes a decrease in the level of estrogen and makes sure that your endometriosis does not grow. However, Dynogest is also expensive and does come with its own side effects. So, Dynogest can be used for a period of months or years, but then again, it cannot be used lifelong, and you have to think of some or the other therapy, even if Dynogest is helping you in the short term. The other method of treatment is a estrogen receptor modulator, which is called as ormeloxifene. And this also is tried by us in quite a few cases and results in good treatment, particularly in those patients who are young, who are unmarried, and who have got very severe disease symptoms, who cannot undergo surgery at present because of their age or because of their other work related life patterns. The other treatment option that we have for patients of endometriosis is called as a levonorgestrel intrauterine device. Now, I'm sure at least some of you may have heard about what a copper T is. A copper T is a simple device that is placed inside the uterus in order to prevent a pregnancy. So, it is a long acting intrauterine contraceptive device. The levonorgestrel IUD is a similar device, also sold sometimes by the trade name and known by the trade name of Mirena or Eloira, or there are several other brand names that are used. And this is a copper T which has medicated content inside the device. So the same medicine that you would consume orally is now impregnated on the device itself. And because this is embedded right on the device and the device is going to be put inside the uterus, it causes release of the medicine locally. It releases the medicine inside the uterus, so the medicine acts better, the medicine acts faster, and has less side effects because you don't have to take it orally and it does not pass through your entire system. If this works for you, the copper T can stay inside the uterus for a period of 5 years, during which you will have a very good relief of pain and heavy bleeding. Of course, again, there are selection criteria for this type of therapy, and not everyone is a good candidate for Mirena insertion. The fourth or the fifth pronged approach that we have for this particular condition are injections. These injections are called GnRH agonist injections. Let's skip the technical jargon, but these are injections that change your hormonal patterns so that there is a decrease in the amount of estrogen which is released in the body. Because of these injections, release of estrogen from the body is blocked. And like I told you before, a sustained absence of estrogen from the body causes the endometriotic deposits to die down and shrink off. Again, there is a time period to which these injections can be used, and they are very good if you are waiting for surgery or if you are waiting to get fit for surgery for a particular time period. So, GnRH injections are of various strengths. You can have them at monthly intervals. There are injections at 3 monthly intervals, but beyond a period of 2 years or so, they also have their own side effects like osteoporosis, and so cannot be used for a very, very long term. So, most of these medicines are available and they are to be used judiciously. In some patients, they will work very well. In some patients, they may not, and these patients may require surgery. One of the last medicines which have to be mentioned before the video ends is something very strange and which surprises patients a lot most of the times, and that is pregnancy. Yes, you heard it right, pregnancy, meaning that patients of endometriosis who do get pregnant naturally or by assisted reproduction have got a natural resolution of their endometriosis problem. And we find that in a huge amount of cases, once the pregnancy carries itself for an entire 9 months, you find that after the child has been born, the endometriosis has resolved itself spontaneously in a good number of cases and then probably remains suppressed for many, many years, and in some cases does not come back at all. So, hence, it is also possible sometimes that patients who are newly married but are not planning conception, we do advise them to try and plan a pregnancy as early as possible, because any delay is going to, one, affect the oocyte quality of the patient because of endometriosis and its progression. So it may be more difficult to get pregnant as time passes. And secondly, the symptoms of endometriosis, once a pregnancy is achieved, can significantly be reduced by the pregnancy itself. And it may happen that you may get cured completely and the disease will not come back at all. So that's all in our non-surgical discussion of endometriosis. If you have any questions, please leave them in the comment section. And if you like the video, please click on the icon above to subscribe to our channel and to keep receiving more updates. Thank you.